Good morning, and thanks for joining us here in the UpNorthLive digital studio. I am Brendan Kinney. This is our second installment. We have a brand new team of experts here. This is your mental health connection. We're going to go around and introduce everybody. Erica, if we can start with you, what you do there at the business, and then we can go from there. Erica.
Yes, thank you. My name is Erica Longstreet. I am a licensed mental health professional here with Northern Lakes Community Mental Health. I have served at the agency for about 6 years. I'm currently in the role as the operations manager over the access department.
All right, and Joe, will go down to you.
Yeah, hi, my name is Joe Barkman. I am the Director of Crisis Services here for Northern Lakes Community Mental Health. I'm a limited licensed psychologist, and I have been on and off with the agency for over 15 years now.
All right, and last but not least, Amanda, good morning to you.
Good morning. Yeah, my name is Amanda Clements, and I am the Crisis Services team lead, team supervisor now. I've been at the agency for about 3 years.
All right, and so what we're going to do, we're going to start with Erica, and if you're looking for, if those of you watching, if you're looking for any help with mental health, anything like that, these are the people who can help, and this is the place to start. So Erica, if you want to talk about, since we're based in Northern Michigan, if you want to go over the counties that you serve.
Yes, so Northern Lakes Community Mental Health, if I could just go into maybe population served as well, Brendan, is that okay?
Yeah, for sure.
So access is really the gateway to our agency. Northern Lakes Community Mental Health, we exist to serve an array of populations, including adults with severe mental illness, children who are considered seriously emotionally disturbed, and both children and adults with an intellectual or developmental disability. We are a Medicaid provider, and we are a voluntary agency. We cover 6 counties: Wexford, Missaukee, Roscommon, Crawford, Grand Traverse, and Leelanau. We have 4 locations: Cadillac, Holton Lake, Grayling, and Traverse City.
And then you did touch on the populations. Erica, is there anything else you want to add on that topic in terms of the populations that you serve?
Just to know that we really are tertiary. So when the population that we serve here at Northern Lakes are, think severe, the most severe to profound populations. And so when somebody's coming through the door in access, and we can go through that process, whether now or a little bit later, Brendan, but there is a triage process to determine eligibility for criteria based on that severity level.
Mm-hmm. And in terms of the services that you offer, is it from essentially birth to death, essentially, Erica?
We do, yeah. We serve all populations and lifespans dependent on eligibility criteria. We cover an array of services, including but not limited to outpatient therapy, case management, psychiatric care, clubhouse programs, peer support, crisis intervention, assertive community treatment, home-based services for children, and infant mental health. We do have some contracted services that could include crisis residential, partial hospitalization, and autism-related services, as well as state and locally funded services that could include the integrative health clinic if someone's in need of a primary care physician. We do serve Grand Traverse County and Crawford County for the integrative health clinic, and specialized residential or supportive independent housing such as AFC.
Mm-hmm. Now, if somebody watching, they're maybe seeing some symptoms in a friend, a family member, what could that look like? Should they be worried? How do they take that first step, Erica?
Yeah, so give us a call. We have an 800 number that is 1-800-492-5742. And what that would look like is you would connect with our support staff. They would obtain your first and last name, date of birth, and a good phone number to call back. And the call is then placed into a queue unless the person is indicating they're in a crisis, which would be an immediate connection with a crisis worker. They would be placed into the access callback queue where one of my team members, all licensed mental health professionals, would return their call in 24 hours and complete a phone screening. Or they could walk into the office, just walk in and speak to a clinician. We do prioritize walk-ins, so we would never leave somebody waiting to speak with a clinician. And I would say if there's any doubt, if you're feeling unsettled or just something doesn't feel right, come in and talk to us. We would be able to complete that screening. The screening is completely free. And it is time at the time of screening, we would determine eligibility for completion of an initial clinical assessment.
Mm-hmm.
And that would determine eligibility for ongoing services. But what I would like to add to that, if I could, when we're talking mental health, if anytime you have doubt, just call us. We're here, we're trained, we're licensed, we're here to assist anybody in the community. Even if that doesn't mean necessarily getting open to our services, we would provide community services and resources. We could help outreach with that person to get where they need to be. It's our goal that everybody be able to enjoy their life, have a purpose for living, have a sense of meaning and purpose, and be able to be flexible and adaptive to change. So we're here to help.
Mm-hmm. I imagine that initial call could be maybe a little intimidating at first, but it sounds like everybody there is well trained and knows exactly what to do, or can find help beyond that if somebody else needs additional care.
Correct.
Erica, before we go on to Amanda and Joe, is there anything else that you wanted to mention? And this is a fluid conversation. If you need to mention anything else, or if Amanda and Joe need to chime in, go for it.
Nope, I think the crisis and access departments are quite fluid as well. So we're here to support one another. And so like if anybody were to call access and ended up being in a state of crisis, we would be able to assist as well.
Mm-hmm. And then we'll go down to Amanda and Joe here. And it looks like we're going to be kind of going back and forth from Amanda and Joe in terms of some of these questions. We'll start with you, Amanda. How would you define crisis?
So crisis is self-defined. It's important to recognize that crisis is self-defined and everybody's crisis can look different. So we must look beyond legal definitions of self-harm and others and decide, what kind of response is needed. Sometimes it's, just needing to have somebody to listen to. Sometimes we're looking for inpatient placement. The uncommon crisis event and feelings can be intense for personal distress and disruptions in daily lives. So we want to make sure that we're here to support in any of those situations.
Joe, is there anything else you want to add to that?
No, I think she did a good job.
Mm-hmm. Now, in terms of the services that the crisis staff can provide, Joe, do you want to take over from there?
Yeah, so we can provide anything from, as Amanda said, crisis is self-defined. So individuals are more than welcome to call us at any point in time over the phone. Our 24-hour crisis hotline number is 833-295-0616. We have staff available 24 hours a day, 7 days a week, 365. We are also able to walk in to any of our offices and meet with a crisis worker at any point in time who can help you. Some of the other services that we provide is we work with our local hospitals and we provide inpatient hospitalization screenings for folks that may need inpatient psychiatric treatment. We work a lot in the community. So we work with our law enforcement officers. We will do things such as ride-alongs with them. We have technology-based like iPads that we will utilize to, if law enforcement or other community members, I know some of our community partners have these iPads as well. So if we can't get to them or they can't get to us, we can meet, telehealth there as well. We'll meet people wherever they need to be met. I do have mobile crisis services and we're able to, show up in the community. We also have a children's program called our FAST team. It stands for Family Assessment and Safety Team. And that is with a licensed clinician and usually then a second person is available as well. And they will come out and they work primarily with schools a lot. And they will go to the school if a child is having some sort of, an emergency there or a crisis there. that could be also in the home. And again, that service is 24/7 as well.
All right. I was going to say, who is that call coming from? If anybody needs to take a call, I can always mute your microphone if need be.
No, that's the joys of the crisis team. We're always receiving phone calls. So
Gotcha. So it sounds like these services can take place wherever a person needs it. Correct. And then I want to talk about follow-up after the initial crisis. Amanda, talk me through that, please.
So our follow-ups after initial crisis, so it kind of looks differently for everybody, right? Because each crisis is different. So we can do anywhere from having like the initial contacts of like meeting them again in the community at their homes. We can do follow-up calls. Again, like Joe said, we have staff 24 hours. So if we have somebody that's in crisis and they feel like, 2 a.m. is a hard time because of whatever reason, like we have people that we can call and check in on them, make sure they're doing okay, talk them through those processes and those emotions. We also do a lot of reconnecting with other community resources. So if somebody comes to us in crisis and they don't actually qualify for our services, our team knows a lot of community resources. So we can reach out and help them connect to those other resources as well.
And Joe, if somebody's just tuning in, that phone number for the crisis hotline, and how does that process work?
Yeah, again, the number is 833-295-0616. And, again, we have somebody staffed available 24 hours a day, 7 days a week. Ultimately, I guess if it was a, true life-threatening emergency, I would direct people to contact 911 as well. But again, any point in any time somebody needs to talk to somebody, because again, crisis is self-defined, please give us a call. And kind of as Amanda had mentioned, if we can't, if we need to refer you out, we will. And, we do work with our access department. As Erica mentioned, it's very fluid. So, we work together very closely. So we will hand off if we have somebody that comes in a crisis and, they want ongoing services with us, we'll do a warm handoff to an access clinician. And vice versa. If they're meeting with somebody and it seems like they're in a crisis, they refer back. So we have a very good working relationship together.
Mm-hmm. And if anybody's just tuning in again, we're all based in Northern Michigan, but anybody can answer this here. If somebody doesn't want to make that phone call, they want to go see somebody in person, what are those locations? And talk me through that process, please.
Yes. So our walk-in practice, our locations are Cadillac office, Holton Lake, Grayling, and Traverse City. We cover 6 counties. Those are our 4 office locations. So if somebody doesn't want to call by phone, all they have to do is walk in and say that they would like to speak to an access worker or crisis worker, depending on what their need is and that level of care at that time. And we would meet with that person face-to-face and complete a screening or crisis contact, whichever is needed.
Mm-hmm.
Just to follow up with the offices in the counties. So, we service 6 counties with Northern Lakes Community Mental Health, Grand Traverse, Leelanau, Wexford, Missaukee, Roscommon, and Crawford County. And we have offices in Traverse City and Grand Traverse County, Cadillac and Wexford, Houghton Lake and Roscommon, and Grayling and Crawford County. Mm-hmm. And we are fully staffed with every office has, an access and crisis workers available.
Mm-hmm. Is there anything anybody else wants to add? Anything I didn't ask? Anything else you want to touch on before we say bye for now? All right. We'll leave it at that. We appreciate your time, Erica, Amanda, Joe, and hopefully you watching this, if you or somebody is in dealing with the crisis, hopefully this helps to maybe put some faces and names to people behind whoever is answering your call. So thanks everybody for your time today. We appreciate it.
Thank you.
Thank you.
Thank you.